My name is Bradley Myers, and I'm doing my presentation on coronary artery disease. Coronary artery disease is caused by a buildup of plaque in your coronary arteries, which can potentially lead to a blockage, and it would cut off the heart from receiving key nutrients like oxygen. The date of discovery of coronary artery disease is not actually known, but it has a condition described as hardening of the arteries was discovered in some medical journals as far back as the 1700s. Coronary artery disease, you can exercise with it, and it can cause numerous symptoms such as chest pain, shortness of breath, and heart attack. It is not recommended to perform vigorous amounts of exercise or at a vigorous intensity due to the potentially life-threatening symptoms that it may cause. And here is the, this is just a display of the plaque buildup. Coronary artery disease, management and medication. Various medications are available for the treatment of coronary artery disease, such as cholesterol modifying medications, aspirin, beta blockers, nitroglycerin, and some over-the-counter medicines that you can take are omega-3 fatty acids. Self-management is also available for people with CAD, quitting smoking, controlling your blood pressure through diet and exercise, and controlling your weight are all ways that you can manage coronary artery disease. The exercise testing for CAD, individuals will perform an exercise known as the stress test. It's very similar to the VO2 max test. They hook you up to an electrocardiogram or EKG and measure your oxygen intake and outtake. And basically they will monitor your heart rate, your breathing, and the test will include walking on a treadmill at the speed and incline slowly increasing. As soon as the individual finishes the testing, they're immediately removed and they have their blood pressure taken. And depending on the results of those tests, doctors are able to determine if they have CAD. Also, precautions should be taken when testing patients for CAD because they could potentially suffer a heart attack. And if they show any symptoms of shortness of breath or chest pains, they should immediately be removed and the testing should cease. With physician's clearance, you can exercise. It is okay for an individual with coronary artery disease to perform 30 to 60 minutes of moderate physical activity, most if not all days of the week. This could include cardio and or weight training. And these are my sources. And that concludes my presentation on coronary artery disease.